So thank you very much for having me, and it's my pleasure to introduce to you healthcare innovation at Sheba Medical Center in the COVID-19 era. Our description from just the past few months since we met COVID-19. As I start, it's important to say a few words about Sheba Medical Center. Sheba is the largest medical center in Israel, also largest medical center in the Middle East. It's one big campus, as you can see here in this aerial photo, a small city, if you might, a hospital of 2,000 beds, which has an acute care hospital, a rehabilitation hospital, a children's hospital, a women's hospital, and a cancer hospital, all on one campus. Fairly big area, as you can see here, with a very strong and wide footprint in Israel. And on top of that, Sheba was chosen to the top 10 hospitals in the world by Newsweek just earlier this year, as we were ranked as number 9 from 2,000 hospitals that were ranked by Newsweek at the time. We're, of course, very proud about this achievement. At Sheba, a cornerstone has always been research and also innovation. And within that, we have established the Ark Innovation Strategy, which is our innovation program, launched officially about 8 months ago, but in the plans and development for the past 4 years. And Ark is basically an ecosystem that has a clear vision of what healthcare needs to look like by the year 2030, and working proactively within this ecosystem to reach that reality, to make that vision a reality. And to do that, Ark is based on 4 principles. The first one is a focus on digital health, understanding that if we are going to change healthcare, the main change vehicle is going to be digital health. And within digital health, you'll see in a second what we're focusing on. The second is open innovation, working together with the industry, with startup companies, looking for innovation from outside of Sheba, alongside innovation coming from within Sheba and within our ecosystem to change the future and make that vision a reality. The third is international collaborations. We're working very closely with both academic medical centers from around the world. You'll see a few of the names later on, as well as strategic industry partners, and of course startups that make up the Ark ecosystem. Altogether about 60 different organizations that make up Ark, and it's this organization that is actually enabling us to push forward and again, make the vision a reality. And lastly, it's the innovation infrastructure, starting from the rules and regulations that govern innovation, which were on a day-to-day basis challenging. Second is the infrastructure for data, which of course is critical as we push especially for big data and artificial intelligence innovation. And the third is the physical infrastructure. And as you see here, the Ark campus, which is now being built at Sheba Medical Center. Hopefully by 2025, this will be completed. 300,000 square feet of innovation space in 5 different buildings. 2 of the buildings already are complete, and this is where our teams are working from currently. But of course, much to wait for as we complete the full campus. These are the Ark Hubs. So as we focus on digital health with the desire to change the future, we're specifically focused on these 6 areas. We call them the Ark Hubs. Each one of those hubs has a director, has a budget, has an annual plan, milestones that they need to reach, and so on, from big data and artificial intelligence to virtual reality and augmented reality to the operating room of the future, telemedicine, of course, rehabilitation, and personalized medicine. This is what makes Ark's work. At the end of the day, the innovation comes from the hubs and alongside our strategy to make this work. And this is the whole Ark ecosystem. And as we look at the Ark ecosystem, you could see the international collaborations from the academic medical centers, really world-renowned organizations, to the corporate strategic partners that you can see here, the startups and the academic institutions here in Israel that we work with to create those innovations of the future. Now, about 4 months ago, we first were presented with COVID-19, certainly an event that is going to change much of the world and specifically healthcare. And one of the first decisions we had to make was, is innovation essential or non-essential in times of crisis? As you know, if you're a doctor or a nurse, you're obviously very essential during COVID-19, but what happens if you work in the innovation center? Is that an essential position? Can you work from home? Can you go on leave of absence and so on? It took us a couple of minutes to make a clear decision that innovation is not only essential, but that innovation is critical if we are to win this war against COVID-19. To make sure that we focus on what we need to focus on in these times of pandemic, in these times of crisis, we came up with this battle mode, basically stating that Ark is now completely focused on COVID-19. And you could see up on the left corner of the slide, the new logo we've actually established to signify that we're now focusing on COVID-19, the Ark COVID-19 battle mode logo. We also had to come up with a game plan. What are we focusing on? So we had the 6 hubs on days of peace. What happens now as we're focusing on COVID-19? We came up with these new 6 areas to focus, from data, which continues to be a focus, to ventilation solutions. We'll talk about that in a few slides. Diagnostic solutions, telemedicine, of course, critical in these times of pandemics, therapeutics, and lastly, mobile health solutions. This is our new game plan as we're focusing on solutions to change the game and the course of this pandemic. And we'll look at a few examples. The first one is a huge necessity we had to deal with. Maximal crew protection as we care for patients inside the hospital with COVID-19. As you know, we wanted, of course, to provide high-level medical care on one end, but also provide minimal physical contact for the staff. Where you have a contact with staff and patients who had the virus, you always have the risk of our staff contracting the virus and, of course, becoming sick and of course, not being able to come to work, which is critical when we need all of our clinical staff available. To do that, we decided we're going to use telemedicine technology that typically allows us to care for patients at their homes, but to use those technologies inside the hospital to care for patients while minimizing contact. You'll see a couple of examples. This is our first isolated corona unit built about a mile, 1.5 kilometers outside of our main campus. We wanted it to be isolated at the beginning. We didn't know how many patients we're going to get, and it was critical for us to allow for continuous operations for the rest of the hospital by having the COVID-19 patients isolated. And we've built this new compound, and as you'll notice here, apart from the compound where patients were, patient beds where we had room for 40 patients in this isolation unit, we've built this tent basically with all the equipment that allows us for the clinicians to care for the patients inside the unit while being a few meters away outside. Let's see how this works. So this is the teletent. As you can see here, this is our clinical team, and they're treating patients who are hospitalized inside the corona unit, just a few meters away from the teletent where they're positioned right now. It took us about 72 hours to deploy this solution with all the technology we've been using it for telemedicine, but now using it a few meters away to minimize contact with the staff. We use technology to allow that. One is monitoring technology. We need to be able to monitor those patients. These were patients that were mostly mild or moderate disease severity. We knew that COVID-19 patients can deteriorate very rapidly to a life-threatening condition, and it was obvious to us that what we want to monitor mostly is respiration rate. And we looked for the best respiration rate monitors, continuous monitors available that are suited for patients who are low to medium risk. We decided to use a device called EarlySense. We've used EarlySense before inside our hospital, but this is somewhat of a different use. The device is a monitoring device with a sensor that goes under the mattress, continuously monitoring heart rate, respiration rate, and motion, and then using AI-based algorithm that predict clinical deterioration. We are now conducting a clinical trial that is about to come to conclusion and showing us that we're getting very good results in being able to identify hours ahead of time which patients are going to deteriorate and might need to be transferred to a higher level of care, to an intensive care unit, before they actually crash inside this isolated corona unit. This was one technology that we put to use. Another one, we needed to be able to to perform physical examination on patients, again, who are not in the same room with the clinicians. Clinicians, as you know, are used to being in the same room at the bedside when they examine patients, but here we needed to find another solution. We were using a technology called TytoCare at the home to examine patients from afar. Again, we use the technology for telemedicine purposes at the hospital to allow us to perform physical examination while not in the same room. You see in this example, Dr. Gadi Segal, the head of the Corona unit, who is listening to the heart and lungs of patients through the TytoCare device on the headphones he has and looking at the throat of a patient on the screen, being able to make clinical decisions and better care for those patients. We used other technologies. We won't go through all of these examples, but another technology is, of course, the Telepresence robots. We used many different robots. This is an in-touch robot typically used for Tele ICU. We used it in our Corona patients units to allow for the clinical staff to get to the bedside using the robot, communicate with the patient, examine the patient through the technology that is available as part of the robot, and so on. Again, a technology used for other purposes, but to minimize contact, it was put to use for this purpose as well. We then said, let's use our experience with these technologies as we care for patients a few meters away. Let's use the same examples and the same technology to care for patients who are now at home. And we came up with the zero-touch telemedicine toolkit, which basically had a solution for monitoring, a solution for physical examination, and a solution for management. We use the Datos app, which is our main telemedicine provider, TytoCare for physical examination, and EarlySense or BioBeat for monitoring. It was all packaged in a box, as you can see in this photo here, and this box was delivered to the patient at home, and the patient went through a hospital at home program with COVID-19 for mild and somewhat moderate cases as well. We were comfortable enough to isolate those patients at home and hospitalize them at home. Because we were able to monitor them, we were able to examine them on a day-to-day basis. A doctor was examining them using TytoCare and other technologies from the hospital to the home. And the idea was to offload from the hospital so the hospitals won't get clogged up with mild patients that can be hospitalized at home. And this made a lot of attention around the world, and similar programs have been launched in other locations. So this was our experience with telemedicine. I want to move now to ventilation and say a few words. As you probably know, there was a huge concern that we would run out of ventilators with a huge load of patients, severe patients. It did happen in locations in China. It did happen in locations, as you know, in northern Italy, and even in New York, there were cases of shortage of ventilation devices. We wanted to come up with solutions for ventilation. This was not building a ventilator and taking it through the FDA, which obviously takes time, but this was about building solutions for ventilators that can replace ventilators in times of crisis. We had many different solutions available. I won't go through some examples, but I will give you one example later on as we talk about one of those solutions. And we work together because we don't have the engineering capacity, of course, at Sheba to build a ventilator. We had to work with some partners, mainly in the defense industry. Some of you may know the defense industry during these times of crisis completely mobilized to come up with solutions for healthcare. And this is something that would have long-lasting ramifications, as we'll see many of these technologies used for defense being put for use to healthcare. Obviously, you'll agree with me, a much better use of engineering time and innovation resources. So we had to work with the Israeli aerospace industry and the Mafat, which is the R&D section of the defense ministry in Israel. And many of the solutions came from these collaborations. We had a Tele ICU built. We, about a couple of days into the first wave of the pandemic, we understood we needed a much larger capacity of ICU beds. We actually built an ICU with a capacity for 100 beds in an underground parking garage beneath our women's hospital. Again, took us about 72 hours to build. And it wasn't just building an ICU with 100 beds. It was also about utilizing advanced technology in this ICU. You'll see some examples here from this robot again that was used, the Telepresence robot that allows the staff to examine patients, to telecommunication devices that were put in use, to artificial intelligence technology. What you see here is a solution with a company that worked with us, Clue Medical, to offer a control tower for all 100 beds to allow us to better manage large volume of patients using AI to tell us which patients are going to deteriorate, which patients are doing fine and are not expected to deteriorate, and so on. Actually, the company received an FDA approval for COVID-19 artificial intelligence just a few weeks ago, partly on the data that came from Sheba. We also used augmented reality and virtual reality for tele-teaching and remote guidance. You see here the Microsoft HoloLens 2, probably one of the most advanced goggles for artificial and augmented reality, augmented and virtual reality. And we were one of the first to use this technology, and through our collaboration with Microsoft. And we've put to use it to many different use cases, from remote teaching, as mentioned, but also remote guidance. When a nurse is working inside our Corona ICU, has a problem with one of the devices, instead of bringing in a technician and getting him exposed to the coronavirus himself, she put on the HoloLens and was guided through the augmented reality with a technician who was standing in the back outside of harm's way, of course, guiding her on the augmented reality, how to operate the different technologies. We also used the AI for thermal and contact screening. We used an AI solution built on top of surveillance cameras inside the hospital. You'll see this in the bottom right corner of the screen to identify contacts between staff members. And this was critical for us as we conducted inquiries to understand if one staff member was positive for the virus, who else do we need to put in isolation so that we will break the chain of infection. Instead of running inquiries that took 24 hours on average, it took us about 2 hours to do the inquiries using the AI from surveillance cameras. And data, of course. Data is really one of the biggest assets that we have at Sheba. Very early on in this pandemic, we've decided to upload all of our COVID-19 data to the cloud and allow access to data groups in the country. About 40 data groups worked on the data, and this was finally, about a month ago, we had a final event on June 11th, the Corona Data Challenge, where 6 groups came to the finals and displayed their technology. A panel of 20 judges, 10 from Sheba and 10 from international partners, who came up and we declared the winner, which was a group from Intel, and their prize is they're going to implement their solution in the Sheba IT systems and hopefully save lives as we go through future waves of the pandemic. One last example, a success story, developing a ventilator. I mentioned this early on with one of the units in the Army, a secret unit, an engineering unit. You can see here on the timeline from the 15th of March, an idea proposed through this collaboration. A week later, a prototype built, a simulator trial performed, then an animal model performed, patent submitted, starting production, ventilators delivered, as you see in this photo here on the top right of this slide, as the Army was providing us with these ventilators. 100 of them are now lying in our warehouses. Hopefully, they will never need to be used. And then agreement for commercialization signed, and this is now manufactured and sent to the world. And we think this is a great example of what can be done in a very short while. And you'll agree with me, outside of times of crisis, these timelines are never possible, unfortunately. So this is really the Ark strategy in times of crisis, and we think it works. From acceleration, which is the A for Ark, to redesigning, thinking outside of the box, which is the R, to collaboration with different entities from within healthcare and outside, that really brings in the added value at the end of the day. And when we look at the Ark Hubs, the 6 of them I've mentioned before, and then the new ones that we were transitioning to during the times of crisis. As we move out of times of crisis, which hopefully will happen very, very quickly, we are looking to transition this to the seventh hub of Ark, the Corona Hub or Pandemic Hub, because the idea is we will be much more prepared for the next pandemic that hits, whether it's Corona or anything else. We need to be much more prepared, and this is our view of the future. So I'll finish here. Thank you very much for allowing me to share with you our experience during these times of COVID-19, and I'll be happy to answer questions or work on collaborations. You have the email here for Ark, and we'll be happy to collaborate as we move forward. Thank you very much, and stay safe.